Hi, I'm Dr. Reva Basho, breast medical oncologist and chief medical officer at the Ellison Medical Institute in Los Angeles. I'm live today from the San Antonio Breast Cancer Symposium, here to speak to you about INAVO 123. INAVO 123 is an ongoing phase 3 randomized study evaluating the combination of inavolisib versus placebo with letrozole and a CDK4/6 inhibitor in patients with hormone receptor positive, HER2 negative, PIK3CA mutated, endocrine-sensitive advanced breast cancer. So what is inavolisib? Inavolisib is an alpha-specific PI3 kinase inhibitor. It promotes degradation of mutant P110 alpha, which is the mutated version of PI3 kinase. So the hope is that it'll be a better tolerated and more efficacious agent compared to other agents out there today. Currently, we have data available from INAVO 120, which was a study that looked at the combination of inavolisib with fulvestrant and palbociclib in patients with hormone receptor positive, HER2 negative, endocrine resistant advanced breast cancer with PIK3CA mutation. This study reported a statistically significant and clinically meaningful improvement in median progression-free and overall survival, leading to the FDA approval of inavolisib in this setting. So this current study, INAVO 123, is taking a similar combination, inavolisib or placebo, in combination with letrozole and a CDK4/6 inhibitor, and testing in patients with endocrine-sensitive PIK3CA mutated advanced breast cancer. Patients will receive inavolisib 9 milligrams daily or placebo, a CDK4/6 inhibitor as standard prescribed, and letrozole in 28-day cycles. The study will enroll pre- and perimenopausal women as well as men. For perimenopausal and women and men, they will also receive a luteinizing hormone releasing hormone agonist. Patients will receive treatment until disease progression or unacceptable toxicity or withdrawal of consent. In this study, the primary endpoint is median progression-free survival, and key secondary endpoints include overall survival, objective response rate, and then other secondary endpoints as well. I'll draw your attention to the study schema. So once again, patients with PIK3CA mutated, hormone receptor positive, HER2 negative, endocrine sensitive advanced breast cancer. Endocrine sensitive disease is described as either de novo metastatic hormone receptor positive, HER2 negative advanced breast cancer, or patients who receive treatment in the adjuvant setting and have been off an aromatase inhibitor for at least 12 months prior to disease recurrence. Patients will get randomized 1-to-1 to inavolisib or placebo in combination with the CDK4/6 inhibitor and letrozole. Will be followed until disease progression or unacceptable toxicity or withdrawal for other reasons. And as I said, the primary endpoint is median progression-free survival. Follow-up will continue to look at safety outcomes as well as overall survival as well. So key eligibility criteria shown here. Again, advanced hormone receptor positive metastatic breast cancer with a PIK3CA mutation. Patients have to have either de novo disease or have relapsed at least 12 months after completion of adjuvant endocrine therapy. Patients do require measurable disease by RECIST 1.1, a performance status of 0-1, and because of the hyperglycemia associated with inavolisib, should have a fasting blood glucose less than 126 and a hemoglobin A1C less than 6.5. Other standard inclusion-exclusion criteria are shown here as well. The study is open globally with ongoing recruitment, including in the US. This is really a very important study because we know from a lot of data now that patients with PIK3CA mutated advanced breast cancer have worse outcomes with our standard treatments today. So this is an opportunity to intervene early, introduce a targeted agent early, and hopefully improve outcomes for patients with PIK3CA mutated advanced breast cancer. Thank you.